Hi there, my name is Damilare Jonathan. I'm a registered nurse and a diabetes educator. And in this video, I want to answer a question I usually get on my timeline. And the question is, why do children have diabetes? Some people will ask me, do children have diabetes and why should they have diabetes? So I'm explaining that quickly. Yes, children can have diabetes. They have a kind of diabetes we call type 1 diabetes. It usually occurs in children from childhood, even up until teenage years. Okay, and why do they have diabetes? So this is the cause. For every one of us humans, we have an organ in our body called the pancreas. The pancreas is the one that produces insulin. The insulin is the hormone that helps to control our blood sugar, that is glucose. All right, but in this set of people, their pancreas has been destroyed. All right, and that destruction is usually by a process where the body itself begins to destroy itself. Okay, so because the pancreas is destroyed, all right, the insulin is not produced, and the blood sugar that usually should have been taken up from the blood to the cells of the body to be used for energy so that we can run around and do all of our activities, that blood sugar stays in the bloodstream, okay, and it's not able to go to where it ought to go. And as a result of that, it builds up in the bloodstream and begins to cause a lot of problem to the body. So basically, what is the problem with type 1 diabetes, which you find in children? It is that the pancreas is being destroyed or has been destroyed. And what do we do about this? First of all, how do you get to know that a child has type 1 diabetes? You see them a lot of times. The general symptoms that we find in that of adults usually occurs in them too. The polyuria, which means that they will be urinating frequently. All right, they can even get excessively thirsty. They might begin to lose weight. Okay, and and all of that, those symptoms usually come to play. And if you notice any of this, you have to go to the hospital. They have to be checked and for further evaluation. And let me also mention that the treatment for this kind of diabetes, type 1 diabetes now, is that they have to restore that insulin that the body is not able to produce. So it's not so much about what you can prevent, you just have to manage it. And can I say like that, like the other type 2 diabetes which is found in adults, there is no cure, so it has to be managed. All right, you have to keep taking insulin, and usually it has to be taken for the rest of your lives. Okay, so that's it. I hope this helps. Please share with your friends and families, and do have a lovely time. Thank you.